Hello, ladies and gentlemen. Thank you very much for joining me today on this live podcast on how to make herbal self care a way of life. What is herbal self care? That means you're taking care of yourself using herbal medicine. And to do this, you need to be doing it daily and be proactive. Um, and if to do that daily and to be proactive and prevent disease, like myself, not gone to a medical doctor for 45 years, um, you have to make it a way of life. So why am I bringing up this subject? Well, one, of course, I've had thousands of patients, and every day I meet new ones, and I have patients that I've known for 10, even 15 years. So I learn from the patients as well, and this podcast is hopefully to help even my own patients, or particularly my own patients, to understand the how to make herbalism or self care a way of life. And why do I say that? Because nobody thinks like that, um, except, of course, myself. Because to me, herbalism is all about prevention. But to my patients, it's about, in most cases, their last resort. Generally, when people get a health condition, bad arthritis, high blood sugar, an autoimmune condition, even a cancer, or high blood pressure, or any cardiovascular condition. I mean, most of the time they're going to the doctor to get that information. So they start there or they had pain or inflammation in the intestines, like ulcerative colitis, where you're bleeding from the rectum, or you're having bleeding from your urine. There's blood in your urine. So they go to the doctor to get the diagnosis. And then there's a split, of course, in people's choices. At that point, one path will say, well, let me go home and do a lot of research on YouTube and treat it myself, because they don't want to take the medication, or the surgery, which is understandable, because the third largest cause of death in the United States is medical treatments, including surgery and the adverse effects of medication. So it's definitely understandable why people would be concerned and go home and go on social media and YouTube and be searching for answers for sometimes a couple of years and trying different supplements. Unfortunately, most of the people online are just the blind leading the blind, people who research on the internet and then just repeat it to you, and they're not in private practice, or they don't have any training besides maybe just a little nutritional training, or a chiropractor or an MD, but none of these are fully qualified to treat these advanced conditions, because herbalism and herbs are the ancient form of healthcare. I mean, there's other beneficial things we can get, infrared treatment, we can get ozone treatment, but past times, it was all herbs, Chinese herbs, Indian herbs, South American herbs. That's what they've been using since the beginning of time to treat health issues. So if you're not taking herbs for your health issue, then it's going to be hard to reverse it. And unfortunately, a lot of people get suckered into buying expensive supplements and vitamins. And of course, they're always tricked by the easy cure. Just take this one herb, just do this one thing, just have baking soda with lemon will treat everything, apple cider vinegar. So they go through this phase. I mean, it can last years, where they're trying all these things that they see online. And then they may come to me. But at that point, it's advanced. The condition has got worse. Maybe they've had some success or minimal success. Or maybe they've been able to suppress the symptoms, for arthritis. You can take, CBD and you don't feel it, but you haven't really treated the arthritis. You haven't reversed the condition. So people do sometimes manage their condition better by, okay, now I'm not having any dairy. Now I'm not having any wheat. They do these radical things, but they really haven't reversed the condition. And often the condition is still progressing. They're just, avoiding all these foods and, doing certain things to at least keep it from getting worse or having the symptoms. But eventually, in most of these serious health conditions, which I'm speaking about, I'm not speaking about just a urinary tract infection or a little gallbladder congestion or a cold or flu. I'm talking about serious chronic health conditions. Eventually, they're unsuccessful, and then they come to me at the end. So now they've been, and even by the time the doctor diagnosed you, that's already advanced at that point. I mean, I can diagnose health problems years in advance, as per Ayurveda. In Ayurveda, we have 6 levels of disease, and only the 5th level do you even see the side effects, or does it manifest? The disease is manifesting now. Now you can see it. But Ayurveda can see the imbalance in the 3rd stage, and definitely in the 4th stage, we can see the signs and symptoms, even though the condition hasn't fully manifested. So, and this happens to me all the time. I tell people, oh, you have degenerative bones. And they don't believe me. And then 5 years later, they fall, break their hip, and they had degenerative bones for some time. But, because we're not going by the blood work, I can look at your fingernails and see if your bones are degenerative or not, or your teeth. So an Ayurveda is very sophisticated in its diagnostic approach, so we can see things before they actually manifest into disease. So by the time you go to the doctor, it's already in Ayurvedic terms, the 5th stage. The 6th stage is now it's damaging your tissue. It's even more advanced. So you're already in the late stage by the time you go to the doctor. And then if you choose that path not to take any medication, then and just, try fads and smoothies online and things like that, then it's really still progressing along. So by the time the people come to me, it's advanced. Now, the other path that people take is, of course, they take the medicine. And sometimes they even do the surgery. Like this week, I had a woman who had her uterine fibroids removed over a year ago, and they all came back. And she doesn't want to do the surgery again. So sometimes we've had people who've had tumors removed and now they're coming back. So surgery isn't always, a cure. If there's a pathology that led to these growths, and you didn't stop the pathology, then it's just going to come and happen again. So then they come to me. But in most cases, the people will take the medication, their diabetic medication, and then after 5-10 years, they have the side effects. Of course, for men, the side effect is often poor sexual performance, which gets them in the door. But many of these medication, like high blood pressure medication, will also lead to kidney failure. So then their kidneys are starting to fail, and then they find out it's due to the medication. So they have to get off, or they're taking other medication and it's upsetting their stomach. So then the doctor's giving them medication for their stomach, and then it becomes a cascading problem. Some pain medication will leave you constipated, and then they're taking medication for that. Some medication will make you dizzy or lightheaded, and sometimes they have to take more medication for that. So they go down that medication route, and this can go on for even up to 20 years. And then the side effects come, and then they come to me. Again, nobody stopped the pathology. Nobody stopped the habits, the food that they did originally to create the problem. I still get diabetics drinking soda pop. I still have people with high cholesterol and fatty liver eating steaks, and I still have people with insomnia drinking coffee. So nobody stops these causes. And of course, people with inflammation in the colon, nobody's stopping the tomatoes or the hot spices that cause the problem. So it kind of creates a dependence on the medication. And so as long as they're taking the meds, they can kind of, let's just say manage it. But they haven't reversed it, because the day they don't take the med, the blood pressure goes back up, the inflammation in the colon comes back, and, the blood sugar spikes again. So they never manage it. So that's probably the most common path people take, is take the medication, take it for 5 years, 10 years, and then they'll get online and when they start get the side effects of the medication. And a lot like kidney failure. A lot of people are coming to me with kidney failure, and the cause, of course, is the ACE2 inhibitors, the high blood pressure medication, which a lot of times their doctor even tells them was the cause of their kidney failure, because all medication is slowly damaging your kidneys and your liver. So when people learn that this medication is creating these other symptoms, it could be dryness, could be low libido, could be headaches, and now their kidneys are creatine, GFR, kidney numbers are deteriorating, and then somebody tells them, well, that's because of the medication you're on. Now they have this motivation to get off the medication after taking it from 5 to 20 years. Then they go online and do the trial and error online for sometimes years. And then they come to me. Again, they're coming at the late stage. All of my patients. I can't even remember the last patient who said, hey, my health's pretty good, but I want to learn a better diet according to Ayurveda. I want to be proactive. I want to be preventive. Nobody comes to me for that. Now, of course, a lot of common sense can be applied to be healthy and proactive, eating better, taking whole food supplements, not drinking, not smoking, things like that. And a lot of these people already do that. Unfortunately, this won't be enough to reverse a serious chronic health condition, because the treatment that's been used since the beginning of time for all health conditions has been herbalism. In all cultures, South American culture, South Asian culture, the Indian culture, the Indian system of Ayurveda, which is what I was trained and follow. And then, of course, Chinese have their system. Some would say heavily influenced in the early days by Ayurveda, but they have their very sophisticated and detailed herbal system as well, which involves other things like acupuncture. But to get acupuncture without the herbs, you're really missing the point. And it would be like getting an Ayurvedic massage without the herbs. The herbs are the treatment. And that's what can reverse all of these health conditions. So my point is, people are seeing my herbal treatments, or any herbal treatment for that matter, as a replacement to their medication, because they don't want to have to take the medication. And so their perspective of taking the herb is the same as taking a medication. They want to get off of it as soon as possible. They don't want to take it long. They don't want to take it forever. They're scared a lot of times to just take herbs. I know people taking 5 or 6 medications, and then they're scared to drink a cup of tea. So there's this fear that's been, ingrained or conditioned into our Western society that herbs are dangerous. And of course, this is greatly due to censorship, misinformation, and the inability of people like myself to really come out and say what we're doing. It is improving, no doubt. There's become less censorship, more openness, and somebody like myself is feeling more comfortable in just the last 5 years, particularly after COVID, to speak up. But not during COVID. There was even more censorship during that time than there is now. So, things are opening up, and there are other Ayurvedic doctors and Chinese herbalists like myself treating advanced conditions. And we're just keeping a low profile because of the censorship taking place. We can't create a lot of waves, even though we're treating serious health conditions every day that the Western world still believes are untreatable. So here's my point. My point is that herbs should be a way of life. That's what we're talking about. Herbal self-care. It's a way of life. It's not a replacement for medication. Medications only existed for a little more than 100 years. Your grandparents were all taking herbs and tonics and different things. The Native Americans were all taking herbs. The South Americans and the shaman herbal doctors were all taking herbs. So all there was herbs for tens of thousands of years. It's only been in this short, recent time where we've been taking pharmaceutical medication. And a lot of that information we did, of course, get from the Nazis, who were very advanced in pharmaceutical care. And unfortunately, they did um, practice on their prisoners, and they over abused a lot of these medications, particularly amphetamines and barbiturates. But then after the war, the scientists came over um, to the Western countries, the France, England, the United States, all absorbed these scientists, and then we got a lot of the information about the pharmaceutical medications that the Nazis were creating. So they were the best of pharmaceutical. They were the leaders in pharmaceutical medication were the Nazi regime, and partially because they were testing on humans, which is now against the law in the Geneva Convention. So back to herbalism. We need to think of taking herbs in a different manner. We need to think of being preventive and proactive in maintaining our overall health and wellness. So I'll repeat that. We need to understand that we don't want to just use herbs only to treat a specific ailment, but to be proactive, have a proactive approach to maintaining your overall health and wellness and avoiding health conditions. It even goes as simple as a common cold. When I get like a little sore throat, I start taking my cold and flu tea, and by morning I'm fine. But unfortunately, most people, they don't take that quick proactive approach, and then it's worse in the morning, then it's worse, and then maybe they have pneumonia, and then they go to the doctor, and then they're home in bed, and then they call me, and then I send them the herbs for respiratory infection and can knock it out in a couple days. Again, always waiting too long when they should just be sitting there at home with some immune tea during the winter time, drinking your immune tea. Many companies, including myself, we make immune tea. My 19-year-old son sells immune tonics. I sell 2 or 3 immune teas plus like 4 immune formulas from Ayurveda based on your prakriti or body type. Other companies, even in the supermarket, you can buy immune tea. So these should be taken regularly in the winter as it gets cold to be preventive. And then have like one of my products, cold and flu tea, to actually fight the cold or flu in the early stages. Because once it progresses, then I have to give you much stronger herbs called respiratory infection formula. And there I have a couple different variations, one with mucus, one without mucus. But the whole point is prevention is so much easier. And that's what you want to do. That's why I haven't been to a medical doctor for 45 years, is because I'm trying to catch all these little health issues in the early stage. If I feel a little bloated, I'll start taking herbs. If I only seem to have one bowel movement, it didn't come till later in the day, and I feel a little blocked up, well, that night I just take some herbs to get my bowels moving. I don't wait till I get constipated. I'm sleeping great now these days, but there's some times where I'm lying in the bed and I'm not sleeping, so I just start taking my sleeping herbs. When I travel, I get more constipated. When I travel, I need sleeping herbs when I'm on the other side to kind of readjust to the time change. And I'm taking herbs all throughout the day. It has to become a way of life. You brush your teeth. It's a way of life. So, I get up in the morning, I brush my teeth, wash my face, throw a little water on me, clean my tongue. And then, first thing I do is go right in the kitchen, heat up the water, and start taking my herbs, or even just start preparing them. Often get a couple cups and put like a few out, one for morning, one for afternoon, and then maybe just one later. So in between appointments, I can walk up to the kitchen and there's already the next cup ready. And I also have like little herb capsules sitting on my desk. I've got little herb formula here for my brain and memory tonic. And it's almost empty. And sometimes I just get that and just dump it in a tea. Whenever I go for a drive, I make a cup of tea. Whenever I start a webinar, I have a cup of tea. Whenever this is actually an immune tea here, even though I don't have anything. I'm just very cold here. And I just put some brain herbs in it. And then sometimes I can pop down some herbal capsules as well, which I also have sitting on my desk. These are immune modulating capsules. They're just little herb balls. And then, uh, but I feel they're very good for me. I pop those in. So while talking to you, I've just had an immune tea, brain and memory formula, and immune modulating capsules just while talking to you. So, you have to integrate it into your life. Whenever I start an appointment, I always come with a cup of tea. Whenever I start a webinar, I make a cup of tea. Whenever I get in the car, go for a drive, I make a cup of tea. Sometimes I'm making relaxing tea. Sometimes I'm doing brain tea. Sometimes I'm doing memory and energy tea. Um, Sometimes I'm doing sleeping formula. That's a way of life because I'm trying to keep everything running good. I'm trying to keep my digestion good, my elimination good, my sleep good, my energy good, my libido good. So there's herbs that can be taken for everything. And that's what you want to do. You want to make it a way of life. Don't wait until the health problem comes. Don't wait until your little sore throat develops into pneumonia. Catch it in the beginning, drink your immune tea all winter long, and then you don't even get the sore throat. That's just a good example. But even with arthritic pain, in the early stages, start treating it. But unfortunately, in our society, we think things like urinating at night, joint pain, these are part of aging. Well, that's completely incorrect. My mother's almost 90. I've got clients in their 90 who I've treated in their 90s who I've treated for arthritis, and they have no arthritis. It's completely reversible, and I'm not the only one doing it. And just taking, white willow bark or CBD or one herb isn't going to do it. There's many causes to arthritis, and those have to be identified. And the people are generally creating the health problem themselves. That's a whole nother subject, but everybody's creating the health problem. And unfortunately, a lot of people try to blame their genes or their grandparents. And maybe you have a predisposition to some condition because your great grandparent had it, but mostly they had the same bad habit of like just eating steaks all the time. Now you're eating steaks, and then they had fatty liver and high cholesterol. Now you got fatty liver and high cholesterol. So you didn't get it in your genes. You got it from eating the steak. Or if you're Indian, Pakistani, or Mexican, you could be having chili pepper and hot spices. And your parents maybe had irritable bowel or in IBS, and now you've got it. But the cause is the hot spices, not your genes. So it's kind of another subject, but you have to eliminate these causes. That's part of your proactive treatment, taking herbs, and not doing things that could make the condition worse, which is, what I'm doing when I'm treating people and doing appointment is first I'm identifying the causes. Number one, I don't just jump in and start giving you herbs. I got to figure out why this person has this condition, and they're creating it every time. And so I have to explain to them, they have to stop all these habits. Sometimes people got candida from having smoothies. People got gas and bloating and constipation from snacking on nuts. It goes on and on. And then once you remove those, then of course, we have to give them the right diet for their own dosha or prakriti or body type, because unfortunately people just follow extreme diets online, and that could be even part of their problem. And then finally, we use the herbs to treat and reverse the actual condition. So the herbs are the main treatment, not the diet. And a lot of times the smoothies and the nuts and the granola bars, they all have to go. They often are causing more trouble than good. So herbalism really needs to be a way of life. Self-care needs to be a way of life. You need to be proactive and address all health conditions in the early stages. And even you can start doing that yourself. Most people don't even treat their own health conditions by going on YouTube in the early stages. They still wait until the later stages when the condition is more advanced anyway. I mean, if you started catching these conditions in the early stage, maybe there's enough information on YouTube to change your diet, take a few vitamins and minerals and supplements are not herbs, but they are preventive. I take food-based supplements and vitamins every day. I'm taking a natural D, I'm taking natural magnesium at night. I take D probably twice a day. And particularly in the wintertime, I'm taking zinc, particularly in the wintertime. I'm taking a food-based multi, and I'm also doing my food-based superfood. So I'm doing supplementation. I'm just using foods more like wheatgrass, barley grass, spirulina, and things like this, um, which are preventive by nature. So it's good to herbal, food-based supplements can help in being preventive. And I have given webinars on using food-based supplements and the value of food-based supplements and nutritional self-therapy to avoid health conditions. So everybody could be doing that in the early stages. And then as the condition advances before it gets worse, then you're going to go to a good herbalist or make an appointment with myself and treat it quick and clean when it's easy. Think of a person who's got this squeaky noise coming out of their car, and then they just keep going and keep going and keep going. And they're like, looking online what to do. Somebody says, spray some WD-40 in there, and they spray it in there, and the squeaky goes away for a while. Then it's back. And, this goes on for a year or two. And then they take it into the car dealer, and the car dealer says, well, I mean, now your brake drum is damaged. It was only your brake pads, but since you didn't bring it in, you kept driving it. Now we have to change your whole brake drum. It's the same. You got a problem with your car, you got to take it in early. You don't want to just keep dinking around, messing around, and guessing what the problem is when there's some mechanic who could just fix it quick and clean and get the job done. And, how much are you going to learn about fixing your car by watching YouTube videos? Now, I do fix my cars and I do watch YouTube videos, but more about maintenance and understanding and things like that. But you got to take it in. And I find a little problem with the car, and then I take it in and I tell the mechanic, look for more problems. Don't just check the fluids, check the filters, and, make a little extra effort to find problems. Because if you tell a car mechanic to find problems in your car, he's going to find problems. And if you come to me and you don't even have any health issues, I'll find plenty of health issues, particularly if you're in your 30s and the 40s. I can tell you your health issues that are going to come in the 50s and the 60s. Just like a car mechanic will tell you, if you don't do this, you're going to have a problem in another 100,000 miles. He knows it's his job. He's doing it every day. So this is what you want to do. You want to come into the herbalist and do regular checkups. You want to take your car in for the oil change every 3,000 miles. You want every 10,000 miles, you want to have a mechanic look at it, whether you have any problems or not. All these filters need to be changed on a regular basis. You don't want to sit around and wait for the problem. To take care of your car, you have to be proactive, and you have to be good at maintenance. It's the same for the human body. You have to be maintaining, and be proactive and quickly resolve health problems before they progress. And then and think of yourself as taking herbs all the time. A lot of my patients, they took the herbs when they had the health problem, like, they had the high blood pressure and the arthritis. So they were kind of motivated to take the herbs because they had the pain and they didn't want to take the med. So they were all motivated. And then, eventually the herbs improved their cardiovascular system. The blood pressure came down. They didn't need the herbs. Their arthritis went down, so they stopped the herbs. And then you give them 5 years later, they're back with another health issue, or the same health issue just came back again. So because they think of the herbs as like a treatment and they're done. No, you have to make it a way of life. I mean, if you've had arthritis bad once, you're probably going to have to take some herbs just to keep it in check and follow that diet that I gave you to avoid the inflammatory substances which created the condition in the first place. And if you have trouble sleeping, you could be taking sleeping herbs your whole life. I've been taking those brain herbs for 30 years. I've been taking certain herbs for 30 years. I've been taking colon herbs for 30 years, not every night, but pretty regularly. So it's not like a bad thing that I have to take colon herbs or sleeping herbs or brain herbs. The brain herbs are mostly for prevention, and they definitely make me feel more sharp and clear. And sleeping herbs, I only need them sometimes, but the herbs are not going to hurt you. They're just ground up plants, barks, leaves, and they're full of vitamins too. So you can be taking herbs all day and you're going to get all these vitamins and nutrients. People don't think about that. They don't realize that when you take herbs morning, afternoon, lunch, and evening, you're taking like big doses of vitamins in natural form because they're all plants. They all have vitamins. We do have some products like we have superfood nutritional tea with nettle and horsetail and alfalfa. These are herbs that are known to have a lot of nutritional content. And we just put some peppermint and spearmint in it. You can give it to kids and they can drink it and get a lot of vitamins and even feel some energy from these. So all herbs have nutritional value. So they can be taken long-term and they're not going to hurt your liver or your kidneys. If you've had gallbladder attack in the past, you're probably going to have to not only be careful with the diet, no fried foods, no hamburgers, no steaks, but you're going to have to also be probably sipping some liver tea, gallbladder tea, or at least be having dandelion tea 1 or 2 cups a week, probably for the rest of your life. And there's some people that just are born with certain weak digestions and get constipated easy, and they're probably just going to have to keep taking herbs for the rest of your life to keep those bowels moving. And many people say, well, if I follow the diet you gave me, I don't have the gas, the bloating, the constipation, but I can't always follow it. Sometimes I'm traveling, and then you have to take the herbs to compensate. So that's how it becomes a way of life. You're seeing the herbs as a positive thing, not some treatment only for your ailment, but you're taking them to just keep your whole system going. Kind of like I have an old car and I put these fuel additives in the fuel, and that keeps the carburetor clean and cleans it out. So it's like herbs are like that. You're adding the little additives, to your diet to keep your liver moving, keep your bowels moving, keep your brain sharp, keep your circulation good, keep your immunity strong. And they're like little food additives that are herbal additives you're adding into your diet to improve and prevent, improve your overall health and prevent other health issues. So that's what you need to do. Make herbalism a way of life. Keep drinking your sleeping tea if you need it. I mean, I've been drinking green tea since I went to Japan in 1980s, and now I sell mini teas with different green teas in it. So, that's like 40 years of drinking green tea, but that's kept me off of coffee. And green tea is anti-inflammatory. Well, the coffee bean, whether it's decaf or not, is inflammatory. So if it wasn't for green tea, I'd probably be addicted to coffee. And so that's been helping me a lot. So I've been taking herbs, my entire adult life. And that's how I'm staying healthy and young and vigorous and out of the doctor's office, out of the hospital, and being, of course, hopefully a good example, living as making herbalism a way of life, making herbal self-care a way of life. That's what you want to do. And that's why I sell my products on herbmanteas.com. Herbmanteas.com is selling over 200 of my products. And now my patients do buy the products there that I already prescribed to them. But the real purpose is so you can be buying digestive formulas, sleeping formulas, immune building formulas and teas to be proactive and to allow these herbs to become a way of life and not just be running to me when you've got a serious health condition and you have to then now take more advanced formulas, custom formulas, because your condition's so advanced. If you just buy these herbs on a regular basis and take them on a regular basis, you will see your health will improve very quickly, even 1 year. I've had people with cancer or serious conditions, and after they were done, said, not only did the doctor say that my cancer is gone, there's no trace of it anymore, my skin's better, my energy better, my bowel movements are good, my digestion's good, and I lost 10 pounds. So it's not like take this herb and your cancer's gone. You have to treat yourself holistically. So you have to be taking other herbs as well. Like, you're not going to get rid of your cancer if you can't sleep. So, because you need the sleep to restore and rebuild yourself. And people always look for, like, oh, just take this apricot seed and you're going to get rid of your cancer. I don't think so. If you're not sleeping, you're not going to reverse your cancer. So you need to keep yourself sleeping, keep the bowels moving, keep the digestion going, and stay away from medication and stay healthy. Okay, I hope that helped you. Hope that helped you understand how to make herbalism a way of life and what is herbal self-care. And I wish you all the best. And of course, if you have any serious health condition, then do schedule an appointment with me, and I'd be happy to identify why you have the health condition, give you a therapeutic, individualized diet, and of course, herbal remedies to reverse the condition. Thank you very much, ladies and gentlemen. I wish you the best of health and happiness.